Hello friends, welcome back to my YouTube channel Dentistry on Tips. Today we'll be learning some more mnemonics of the subject oral pathology and I'll help you to retain and recall them. And if you have missed the first part of this video, then you can watch it on my channel. I have published it. And without any further delay, let's get started. So today we'll be learning about Van der Woody syndrome, Asher syndrome, orofaciodigital syndrome, Michaud syndrome, Melkerson-Rosenthal syndrome, and Beckwith-Wiedemann syndrome. So let's start with the first syndrome, that is Van der Woody syndrome. So first of all, what is Van der Woody syndrome? In Van der Woody syndrome, we have to remember mainly three things. That is cleft palate. The patient presents with cleft palate or cleft in lip and pits on the lower lip. Okay. So in the extreme left, I have put the image of the patient. Okay, in this you can see clearly that he is having pits on the lower lip and a cleft in the lip, upper lip. Okay, and in the extreme right, I have put the image of cleft palate, and so how to remember it. I have highlighted the two letters, that is V in Vander and W in Woody. So you flip the letter V and you associate with the cleft palate, and you can flip the letter W and you can and give two dots at the end so that you can associate it with the pits in the lower lip. Okay, you have to revise no matter how much I tell you or how much mnemonics people publish on their channel. You if you don't revise it for 2 to 3 times, you won't remember it. And I would suggest you discuss these things with your friends so that you will remember it very nicely. Okay, so let's get started with Asher syndrome. And first of all, we have to remember three things. Three things are main, are very important in Asher syndrome, that is blepharoklasis, double lip, and non-toxic thyroid enlargement. Okay, so what is blepharoklasis? It is inflammation of the upper eyelid of the patient. Okay, the upper lid of the patient swells. So in this picture you can appreciate this boy. He is having double lip and his upper eyelids are having swelling. So you remember this is Asher syndrome, and in the next slide we'll see the mnemonics for Asher syndrome. Okay, so A for absent chin dimples. Okay, S for swollen upper eyelids, that is also called as blepharoklasis. C for cleft lip or cleft palate. H for hearing loss. This is not important, hearing loss. Only the thing which is important is cleft lip, cleft palate, swollen upper eyelids, okay, and non-toxic thyroid enlargement. And the next one is hearing loss. E for external ear abnormalities, R for renal anomalies, and S for short stature. And if uh, any question comes in exam, so how much the length of the question doesn't matter. You just have to remember only three things, that is blepharoklasis, double lip, and non-toxic thyroid enlargement. Okay, next we'll see orofacial digital syndrome. So I guess, this syndrome is mnemonic in itself. Okay, so the name only gives you the clue of what is the syndrome about. So whatsoever, I have put some images on the slide, so you can see this child is having lobed tongue. Okay, first I'll show you this thing. Okay, what is oral syndrome? Oral syndrome are cleft tongue, cleft palate, missing or supernumerary teeth. Okay, in this the main is cleft tongue. The patient will appear with lobed tongue. Okay, now facial will be cleft lip, broad or flat nasal bridge, widely placed eyes. I have told you in the last presentation or last part, first part of this video, hypertelorism. What is hypertelorism? It is widely placed eyes. Okay, and in the next slide, I'll show you hypertelorism. I have put some images. And what are digital syndrome? Digital, there are fusion of fingers or toes, which is also called as syndactyly. Digits are shorter than usual, which is also called as brachydactyly. And extra digit. The patient may have extra digits, which is also called as polydactyly. And now I'll show you the photos. Yeah, this oral, this is cleft in the tongue, you can see lobe tongue. In facial you can appreciate hypertelorism very well, there is a distance between two eyes. And in digital you can see this, they have fused fingers, toes. Okay, multiple fingers also. So remember this is very easy. In the next slide we'll see Measure syndrome. Measure syndrome, it is also very easy to remember. Just remember the first part of this word. Okay, measures. From measures you can associate Miss. Miss has big lips. Okay, now in this you can see I have given some, put some pictures in this. The patient is having bigger lips and also having angular cheilitis, and this which is also called as orofacial granulomatosis, swelling caused by granulomas on face, inner cheeks or lips. Okay, cracked, the patient may also have cracked and swollen lips, dry and itchy skin around the lips, so you can appreciate this. Okay, yeah, so this is a very good mnemonic for you all. It's funny, I know, but it will help you to remember what is Misha syndrome in your exam. Okay, Miss has big lips. Okay, you can also remember Miss Rosie has big lips. I'll tell you why I have said Miss Rosie in the next slide. Okay, now what is Melkersen-Rosenthal syndrome? In this also you can see cheilitis granulomatosa, which we have already seen in Michaud syndrome. Okay, but we have some add-ons on this. Now it includes Michaud syndrome, that is cheilitis granulomatosa. She's having, you can appreciate in this picture, she's having bigger lips. Okay, and if she has bigger lips, then yes, she'll also have cheilitis. Okay, now what is the add-on here? The patient will have scrotal tongue. You can see there are fissures in her tongue. I have given the image. There are there are numerous amount of fissures on her tongue, so you can appreciate this very well. Yeah, yes. This is why I said Miss Rosie. Okay, because rose, you can associate rose with Rosie. Melkersen Rosenthal syndrome. What M I have highlighted M. Okay, some things I have highlighted which will help you in your mnemonics. Melkersen Rosenthal syndrome. M you can associate with my son says Miss Rosie has fisher tongue. Okay. So M for my son says Rosie, Rosenthal, Miss Rosie. Miss Rosie means our last syndrome, that is Mishra's syndrome. So you will associate this very well. That's the reason I have told you to give this teacher a name, Miss Rosie. Okay. And in this Melkerson Rosenthal syndrome, you have to remember this thing. My son says Miss Rosie has fisher tongue. Okay. So let's get started with the next syndrome, that is Beckwith-Widman syndrome. What is Beckwith-Widman syndrome? Okay, in Beckwith-Widman syndrome, you have to remember four things which are very important. That is macro. The patient has macroglossia, neonatal hypoglycemia, microcephaly. Okay, and Beckwith-Widman syndrome is also called as Beckwith's hypoglycemic syndrome. Okay, so I'll show you the pictures. Yes, here you can associate this, you can appreciate this patient is having macroglossia, lateral overgrowth, umbilical hernia, ear crease. He's having ear crease, and you can also see facial nevus simplex. This is not important, facial nevus simplex. Only three things which are important are macroglossia, neonatal hypoglycemia, and microcephaly. Okay, yeah, in this picture you can remember for your exam. Okay, give this child a name Beckwith, and you associate this child with this image, and it will be easy for you to remember. Okay, so in this picture you can see he's having large prominent eyes, ear creases, he'll have scissors, he'll have microcephaly. Okay, he'll also have increased risk of cancer. He'll have macroglossia, that is enlarged tongue, congenital hernias, and neonatal hypoglycemia. You see on the extreme bottom of this picture, you can see some sugar cubes kept around the baby. So you can also associate this whole image with this thing. Okay, the name is given neonatal hypoglycemia, and they have associated the sugar cubes with this baby. Okay, and we'll see the mnemonic for Beckwith-Widman syndrome. Now, give the name Beckwith to the baby and associate it with the baby. Okay, that was the first mnemonic you can remember. And this is the second one, Weidman syndrome. You just split this wide man, that is wide big man. Okay, so big means everything in the child is big. What is big? Macroglossia and macrostomia. Okay, and N is for neonatal hypoglycemia. This is very important. Macroglossia, macrostomia, and neonatal hypoglycemia, this is very important. Okay, so thank you for watching, and subscribe and like our channel. Thank you so much. Bye bye.